Niemand ist sicher vor Covid-19.
No one is safe from COVID-19. No one is safe until we're all safe from it. Even those who conquer the virus within their own borders are prisoners within those borders until it's conquered everywhere.
Solange es nicht überall besiegt ist.
Germany's President Frank-Walter Steinmeier at the opening of the annual World Health Summit. Because of the pandemic, this year world leaders from science, politics and business are meeting virtually. The coronavirus is straining the response to the many health crises which already exist. Tuberculosis is still the leading infectious disease. It infects around 10 million a year and kills about 1.5 million. African countries lag far behind the world in the fight against TB and malaria too, which kills 500,000 people annually, more than 90% of them in Africa. And HIV/AIDS still hasn't been conquered. The pressure is on to fight these global health crises, even as we navigate our way through the current pandemic. Welcome to your Covid-19 Special here on DW News. I'm Monica Jones. Good to have you with us. Rapidly rising case numbers, daily talk about stricter measures, including lockdown. Our lives and thoughts revolve around the pandemic, while the fight against other potential deadly diseases is taking a backseat.
Sibongile Zulu is looking for the silver lining. The 47-year-old is HIV positive and lost her job during the lockdown in South Africa. She can no longer afford her own medication. Luckily, a charity organization has stepped in. Almost 8 million people in South Africa live with the HIV virus. Many are now struggling to get any medicine at all. Because of the COVID-19 pandemic, global supply chains have collapsed and are only getting back on track very slowly.
Issues within the supply line, people not being able to get ARVs. We are anticipating and we're very concerned that we are going to see more people being sick with opportunistic infections. In South Africa, we worry particularly around TB, as we have high levels of TB in our country as well.
Coronavirus has also worsened worldwide tuberculosis control. With 1.4 million victims, tuberculosis was the deadliest infectious disease in 2019, topping even HIV/AIDS. Here we see some tuberculosis bacteria under the microscope. The WHO fears that up to 400,000 more people could die of tuberculosis this year. Worst affected are India, followed by Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and South Africa. 2/3 of all tuberculosis patients worldwide live in these countries. Here, the number of tuberculosis reports fell by up to 30%.
And it means that the people were not diagnosed, they're staying at home and they're transmitting infection further. So we are working closely with the biggest funds, bilateral donors, to provide all necessary, not only technical support, but procurement of essential medicines for all high TB burden countries.
Back in South Africa, HIV-infected patients who are afraid of going to hospital because they believe they might become infected with coronavirus come to this outpatient mini-clinic in Nagadwana. This HIV patient's immune system must be kept as stable as possible. This also helps protect her against tuberculosis and, of course, COVID-19.
And for more, I'm joined now by the founding president of the World Health Summit, Professor Detlef Ganten. Good to have you with us. So I believe COVID-19 is also impacting the World Health Summit this year. It's fully digital, as we've heard. How much room is there actually to discuss health issues other than COVID-19?
Well, we have 2.5 days, and we have more than 50 sessions and 300 speakers. So not everybody will be talking about COVID-19, but of course that's an important topic. But just related to COVID-19 is the fact that all the other diseases which are still there, cardiovascular diseases, muscle, bone, mental health, they still exist. and they keep the hospitals and the doctor busy. And one of the problems is to combine, what you need to do for COVID-19, and at the same time don't neglect the patients who are looking for help in other circumstances.
Well, provided that those patients actually dare to go to a hospital right now. We've seen that certainly in spring, that people avoided going to see a doctor or going to a hospital, which of course is very dangerous. But of course, COVID-19 is on everyone's mind. So how big is the risk, you'd say, that we will lose ground in the battle against other infectious diseases, such as tuberculosis, HIV, you name it, because so many resources are currently going into fighting the pandemic?
That is true. That is a danger, but we are all aware of this fact. And at the opening, we have had Dr. Tedros from WHO, we had President Steinmeier, we had Ursula von der Leyen, and others who really have an overview on what's going on and get all the information. And of course, we do whatever we can. It's different in different countries. I think in Germany, if that's a question, we are still coping. In other in other countries becomes much more difficult.
I mean, certainly here in Europe, left, right and centre, we do see certain neighbouring countries of Germany already implementing lockdowns again. Here in Germany, because you mentioned politicians, they're very, very cautious there. What do you tell them?
Well, stay cautious, and common sense is always very good advice. Of course, we do need to do everything we can for COVID-19, but we have to keep the society running. We have to keep the hospitals running in addition to what's asked now in this special situation. The private doctors play an enormously important role. It's usually neglected. I mean, they are not the ones who are preoccupied with COVID, so they have all the other diseases, in their view, and they work. And yes, it's difficult, but I don't think that everything else is being neglected because of that.
Right. So, I mean, it's quite a balancing act there to provide for other diseases while fighting the pandemic. Now, we hear that the first coronavirus vaccines could soon be approved. Do you think that this is going to solve the problem we're facing right now?
No, it's not going to solve the problem. It will be a very important step, but not everybody will get vaccination, when the vaccine is available. Actually, Dr. Tedros said, and President Steinmeier repeated, and this is, I would imagine, on advice of virologists, don't vaccinate everybody in one country, but vaccinate many people in many countries. So try to interrupt the chain of infection, try to protect the vulnerable people, young and old, and with additional diseases. But the coronavirus will be there, and it will take time to really conquer it. We also need drugs. The vaccine is important, but we need therapies to treat people who are sick and who don't get the vaccine or where it's not yet available.
All right. So it's going
and by the way, we don't know when it will be available. We are working hard. I think it's unusual, wonderful concerted effort worldwide. But this is not the solution, as you said.
All right. Detlef Ganten there, founding president of the World Health Summit. Thank you so much for your time. Lots of success for this year's summit.
Thank you very much.
And the question of vaccination is also on your mind. Time for your question, and over to our scientific correspondent, Derek Williams.
How do you decide which parts of the population get vaccinated first?
There's a lot of worry at both the national and international levels that when a vaccine does become available, it won't be distributed to the people who need it most on an equitable basis. But who does need it the most? Well, lawmakers are already coming up with lists of who should be at the front of the line. And with some variations, it's what health authorities around the world will hopefully carry through. Assuming that politicians are able to grasp the idea that this is a global issue that won't be solved by vaccine nationalism, which is a big if. But supplies will also be limited, initially at least. So there needs to be a framework in place to maximize benefits. The Vaccine Alliance, or Gavi, which is the international organization that plays a vital role in vaccine development and distribution all over the world, it's come up with guidelines aimed at providing the most benefit for the most people worldwide, even with limited resources. Over 150 countries have now signed up to its COVAX initiative. It recommends that the first people to get a vaccine should be those most exposed to the disease, which are the healthcare and social care workers on the pandemic front lines. Thousands of them all over the planet have died from COVID-19 already. Next in line would be older people, over 65s, along with those at high risk if they catch the disease, like people with underlying health conditions. Most countries will probably also prioritize professions that are deemed to be essential. People like caregivers in rest homes, or police officers, or those who work in key industries like food production. What's already clear is that children will be far down on the list, not only because COVID-19 is less deadly in general for them, but also because it'll take more time to produce and test vaccines that are specifically tailored to kids.
And Derek will be back again tomorrow. That's all for COVID-19 Special for now. Thanks for watching.